Have you heard of monkeypox? It's a disease that's been making headlines lately, and it's important to understand what it is and why it matters. Welcome back to our channel, where we bring you the latest and most important information on health and wellness. Today, we're going to be talking about monkeypox, everything you need to know. Monkeypox is a rare viral disease that's similar to smallpox, but milder in nature. It's caused by the monkeypox virus, which is found in animals such as rodents, monkeys, and squirrels in Central and West Africa. The virus can be transmitted to humans through contact with infected animals or through human-to-human transmission. Monkeypox is an emerging disease, which means that it's a growing concern for public health officials around the world. In recent years, there have been outbreaks of monkeypox in several African countries, as well as a few isolated cases in other parts of the world. It's important to understand the signs and symptoms of monkeypox, as well as how it's transmitted and diagnosed. Knowing these facts can help you protect yourself and your loved ones from the disease, and can also help public health officials prevent and control outbreaks. So, if you want to stay informed on this important topic, make sure to subscribe to our channel and keep watching this video. In the next sections, we'll be diving deeper into the signs and symptoms of monkeypox, as well as its transmission, diagnosis, treatment, and prevention. Now that we've covered what monkeypox is, let's take a closer look at the signs and symptoms of the disease. Monkeypox typically starts with flu-like symptoms, such as fever, headache, muscle aches, and exhaustion. This is followed by the development of a rash, which usually appears on the face, trunk, and limbs. The rash starts as raised bumps that develop into fluid-filled blisters, which then scab over and fall off. This process can take several weeks to complete, and during this time, the patient may also experience other symptoms such as swollen lymph nodes, chills, and sweating. It's important to note that the severity of monkeypox can vary from person to person. Some people may only experience mild symptoms, while others may develop more severe complications such as pneumonia or encephalitis. If you suspect that you or someone you know may have monkeypox, it's important to seek medical attention immediately. A healthcare professional can diagnose the disease through laboratory testing and provide appropriate treatment. Now that we've covered the signs and symptoms of monkeypox, let's talk about how the disease is transmitted. Body. The most common route of transmission for monkeypox is through direct contact with infected animals, such as rodents or monkeys, or with contaminated materials such as bedding or clothing. Human-to-human transmission of monkeypox is also possible, primarily through respiratory droplets or contact with skin lesions or bodily fluids of an infected person. It's important to note that the disease is not highly contagious, and transmission usually requires prolonged and close contact with an infected individual. While monkeypox is primarily found in Central and West Africa, there have been a few isolated cases in other parts of the world in recent years. It's important for healthcare providers and public health officials to be aware of the disease and take appropriate measures to prevent and control outbreaks. Understanding how monkeypox is transmitted is crucial in preventing its spread. Let's take a closer look at the two main modes of transmission and the risk factors involved. Monkeypox can be transmitted to humans through two primary modes: animal-to-human transmission and human-to-human transmission. Animal-to-human transmission occurs when a person comes into contact with an infected animal, such as a monkey, rat, or squirrel, or their bodily fluids or contaminated materials. This type of transmission is more common in areas where people hunt, trap, or consume wild animals. Human-to-human transmission occurs when a person comes into close contact with an infected person or their bodily fluids, such as saliva, blood, or pus. This can happen through direct physical contact, such as touching, kissing, or sexual intercourse, or through indirect contact with contaminated objects or materials, such as bedding, clothing, or medical equipment. The risk factors for transmission include living or traveling in areas where monkeypox is endemic, working with animals or animal products, caring for infected patients without proper protective gear, and engaging in high-risk behaviors that increase exposure to bodily fluids. Preventing the transmission of monkeypox requires a combination of public health measures, such as vaccination, infection control, and surveillance, and personal protective measures, such as wearing gloves and masks, washing hands frequently, and avoiding contact with infected animals or people. By understanding the modes of transmission and the risk factors involved, we can work together to prevent the spread of monkeypox and protect ourselves and our communities. Accurate diagnosis of monkeypox is essential for effective treatment and prevention of its spread. Let's explore the different methods of diagnosis and how monkeypox is distinguished from other diseases. Diagnosing monkeypox requires laboratory testing and techniques that can identify the virus in patient samples. The most common method of diagnosis is PCR, or polymerase chain reaction, which amplifies the virus's genetic material and allows for its detection in blood, serum, or fluid samples. Other diagnostic methods include virus isolation, antigen detection, and serology testing. However, diagnosing monkeypox can be challenging because its symptoms are similar to those of other infectious diseases, such as measles, chickenpox, and even smallpox. Therefore, it is crucial to conduct a thorough patient history and physical examination to rule out other potential causes of illness. Differential diagnosis with other diseases involves examining the patient's symptoms, travel history, and exposure to animals or people with similar symptoms. Additionally, clinicians may use imaging tests, such as X-rays or CT scans, to detect any complications associated with monkeypox. Early and accurate diagnosis of monkeypox is critical for initiating appropriate treatment, preventing the spread of the virus, and controlling outbreaks. By understanding the different methods of diagnosis and the importance of differential diagnosis, we can work together to detect and manage monkeypox effectively. While there is no specific treatment for monkeypox, there are various supportive and antiviral therapies available to manage its symptoms and complications. Let's explore the different treatment options and how they can help patients with monkeypox. The treatment of monkeypox involves a combination of supportive care and antiviral therapies. Supportive care aims to alleviate symptoms and maintain the patient's vital signs, such as hydration, pain relief, and wound care. This includes providing fluids and electrolytes to prevent dehydration, administering pain relievers and antihistamines to relieve itching and discomfort, and monitoring and treating any complications that may arise. Antiviral therapies, such as cidofovir and acyclovir, have shown some effectiveness in treating monkeypox by reducing the severity and duration of symptoms. However, these drugs are not specifically designed for monkeypox and have potential side effects, so their use should be closely monitored by a healthcare provider. In severe cases, patients with monkeypox may require hospitalization for intensive care and monitoring. Complications associated with monkeypox, such as pneumonia, sepsis, and encephalitis, may require additional treatment, such as oxygen therapy, antibiotics, and anticonvulsants. The key to successful treatment of monkeypox is early detection and prompt management of symptoms and complications. By providing supportive care and considering antiviral therapies when appropriate, healthcare providers can improve the outcomes of patients with monkeypox and prevent its spread. To prevent and control monkeypox, various measures can be taken, including vaccination, personal protective equipment, infection control measures, and surveillance and response to outbreaks. Let's explore these measures and how they can help reduce the risk of monkeypox transmission. Vaccination against smallpox, which is closely related to monkeypox, is the most effective way to prevent monkeypox. The smallpox vaccine has shown some effectiveness in providing cross-protection against monkeypox, and it is recommended for high-risk groups, such as laboratory workers, healthcare providers, and military personnel. However, the vaccine is no longer routinely given to the general public since smallpox has been eradicated. Personal protective equipment, PPE, such as gloves, gowns, masks, and eye protection, can help prevent transmission of monkeypox from infected individuals to healthcare workers and others in close contact. PPE should be worn by healthcare providers caring for patients with suspected or confirmed monkeypox and by people who come into contact with infected animals. Infection control measures, such as isolation of patients with monkeypox, proper hand hygiene, and disinfection of contaminated surfaces, can help prevent the spread of monkeypox in healthcare settings and communities. Early detection and prompt reporting of suspected cases can also facilitate the implementation of appropriate control measures. Surveillance and response to outbreaks involve monitoring the spread of monkeypox and quickly responding to contain and control outbreaks. This includes identifying and investigating suspected cases, conducting contact tracing, and implementing measures to reduce the spread of the virus. By implementing these prevention and control measures, we can work together to prevent and control the transmission of monkeypox and minimize its impact on public health. Monkeypox has important implications for global health and security. Let's explore the wider public health implications of monkeypox, including its potential use as a bioterrorism agent. Monkeypox is a disease of public health concern, especially in countries where it is endemic. Outbreaks can lead to significant morbidity and mortality, as well as economic losses due to the costs of control measures and disruptions to trade and commerce. In addition to the direct impact on human health, monkeypox also has potential bioterrorism implications. The virus can be weaponized and used as a biological agent to cause harm to large populations. The deliberate release of monkeypox virus could cause panic and social disruption, as well as significant economic losses. Furthermore, the global eradication of smallpox has led to a decrease in immunity to related viruses, including monkeypox. This makes the potential consequences of a monkeypox outbreak more severe, as people who have not been vaccinated against smallpox or who have weak immune systems are at increased risk of severe illness or death from monkeypox. To address the threat of monkeypox as a bioterrorism agent, preparedness plans and response strategies must be developed and implemented. This includes enhancing surveillance and laboratory capacity, establishing rapid response teams, and developing and stockpiling medical countermeasures, such as vaccines and antiviral drugs. In conclusion, we have learned about the key aspects of monkeypox, including its definition, signs and symptoms, transmission, diagnosis, treatment, prevention, and public health implications. Monkeypox is a serious disease that can have significant impacts on human health and economic stability. However, by staying informed and taking preventive measures, we can reduce the risk of transmission and control outbreaks. We encourage you to stay updated on the latest information about monkeypox and other infectious diseases, and to take steps to protect yourself and your community. This includes getting vaccinated, practicing good hygiene, and seeking medical attention if you develop any symptoms of illness. If you found this video informative, please hit the like button and consider subscribing to our channel for more educational content on health and wellness. Thank you for watching, and stay safe and healthy.